Hi guys, Nurse Jess here. In this video, I'm going to give you guys the top 5 reasons why I left MedSurg nursing and why I went to outpatient. So a little bit of background information. I am a new nurse. I'm technically still new. I graduated in May of 2020 during the pandemic. My entire last semester of nursing school was online. My senior practicum was canceled. I never really got that hands-on senior practicum like most people who graduated during the pandemic. I'm sure you can relate. So I had accepted a job on a MedSurg / step-down unit floor in February, right before the pandemic hit in March. So I already had that lined up for starting at the end of August after I set my date for my NCLEX in the summer, because I wanted to pass my NCLEX and then start instead of starting and having the graduate nurse license and then still studying for the NCLEX. I just prefer to do a license first and then start working. Other people do differently, that's totally fine. But that's what I did. And I just want to preference this by saying that while I was in nursing school, even during my clinicals, I always knew that I didn't really want to do bedside or floor nursing. I always was just like, I think this is just the thing that people do when they graduate, just to get experience, and then they can move on to what they actually want to do, nursing career for the rest of their lives. I always wanted to do outpatient. Actually, I always said to my friends, I wanted to work in a doctor's office. I want to do something outpatient, but I always thought that I would want to do that after I became a nurse practitioner or after many years of being in MedSurg or whatever. I don't know. I knew from all of my nursing clinicals, which were mostly hospital based. We only had a few rotations or days where we got to shadow other specialties that were outpatient. And even if it was outpatient, it wasn't really for example, I shadowed one day outpatient pediatrics. It wasn't really, it was during my peds rotation, but we didn't really see a lot of that. Our clinicals were mostly in the hospital, as I'm sure plenty of other programs are, because it's just more common. So there was such a push for hospital nursing, and I kind of felt like, well, I was in nursing school, and no matter who you are, it's just you assume that once you become a nurse, you have to work in the hospital, because that's just, the thing that people do after they graduate nursing school. But I didn't really want to do that, but because of a lot of my professors and mentors, they always recommended MedSurg, get your MedSurg experience, get your hospital experience at least 6 months to a year. And so I just thought this is just what I'm going to do for 6 months, maybe a year, and then move on to the next thing. Let me tell you what, guys, I didn't even last 3 months. After 3 months, I was miserable. It was terrible. It was the worst experience I ever had. And it wasn't just because people assumed that I was just miserable because I hated my job. It was miserable because, first of all, it was during the pandemic. You're a new nurse. Being a new nurse is already scary and frightening enough. But during the pandemic, it just made it worse. Not like I was afraid of COVID or anything, but it was just the lack of attention and experience as a nursing student that I felt like I was missing. I didn't feel like I was prepared to be on the floor. I didn't feel like I was safe. I felt like my license was at risk, because even though my preceptors were wonderful, I felt like I wasn't getting, I didn't feel safe practicing. Orientation usually is pretty short on the floor, depending on where you go. My orientation, I pushed for a very long orientation because I felt like I needed it, and my preceptors were wonderful and they accommodated me in that, and it was fine. But once it came to an end, I truly realized I cannot practice on this floor on my own. We were very understaffed. It was a step-down unit and a very difficult specialty. I'm not gonna mention what specialty was, but it was insane. And the schedule, I also did not like the schedule. So let me just preference the top 5 reasons. So number 1, I felt like the workload / pay ratio was not worth it, being on the floor, being a bedside nurse. I know that you can get promoted, and that if you work nights, if you work weekends, whatever, you can make more money. I worked night shift, and I did not think that the amount that I got paid per hour, even starting, was reflected how much work a floor nurse actually does. The 12-hour shifts, honestly, it sounds nice, you work 3 12s in a row and then you get 4 days off, but for a lot of the weeks that they rotated, it would be I would literally work 4 12-hour shifts in a row because one day would like roll over to the next week. So it would be like Thursday, 12-hour shift, Friday, 12-hour shift, Saturday, 12-hour shift, Sunday, 12-hour shift, and then you would have like Monday, Tuesday, Wednesday off. I think maybe Thursday off, and then it would just start again. But like the 4 12s in a row was miserable because not only are you mentally exhausted, emotionally exhausted, and physically exhausted, like you are all those things. So you're so drained. Like I felt so unsafe by like the 3rd or 4th shift, like practicing nursing and doing all these skills and caring for these patients who are like the sickest of the sick, and they need a lot of attention. They need delicate care. They need like you need to have very like meticulous, like detailed, you know, skills to pay attention to these patients. If anything goes wrong, you have to be on it, you know, like that. And I did not feel like even working like 2 12-hour shifts in a row, it was just miserable. And I wasn't even like sleeping well because it was night shift and my body was still adjusting. Even though when I got a little bit adjusted to it, I would have trouble sleeping because I would go to sleep so anxious, like panicking about like my next shift and just feeling so anxious about it. So it was just truly like the longest 3 months of my life. And so that was the first reason. The workload slash the schedule slash pay was not equal. The second reason, actually this kind of goes into the first reason, was I had no like real home life balance. And you might think that sounds weird because all those days off that you have if you worked like a 3-12 instead of a 4 12s in a row, but on the first day that you have off, you're literally sleeping the whole day. So then you have like two to 3 more days off. If between like errands and between like getting your life together and between like cleaning and laundry and all that stuff, it's really not worth it. It goes by so fast. I had like barely any time to catch up with my friends or my family. I know that there's people who work around it, you're flexible, but on those days that you're working 3 or 4 12s, you literally have no life. And then on those like rare, like, and then on your days off, not rare, but on the days that you have off, you have to like just jam pack everything that you can in those days. And for me personally, I volunteer a lot. I go to church every Sunday morning. That's very important to my beliefs. That's very important to my religion. And I would be sleeping on Sundays because I would be working night shifts. So like I would work Saturday night shift and then I would have to work Sunday night shift. So obviously I would come home for my Saturday night shift at like 8 in the morning. Sunday morning, like the late service I go to is at 11. I would really try my best to catch the 11 o'clock service, but it's so hard when you literally just work 3 12s in a row and you're trying to go to Sunday morning church at 11 and you came home at 8 in the morning. And that just was not working for my home life and my beliefs and my schedule. I volunteer a lot during the week sometimes. I am very family oriented. I love seeing my family a lot. So it just, or not a lot, but just, you know, the usual amount that you try to see your family. I have a lot of cousins and a lot of family members that I like to keep in touch with. And so that was not working. That was not working for me. And if you don't have an enjoyable home life, you will never have an enjoyable work life. Things can't be perfect, but you can do your best to accommodate what you need at work and what you need at home so that you can, for the most part, enjoy both aspects of your life. So when you're at work, you can, you know, do your best and you don't feel like all this anxiety and stress because your home life is a mess. When you're at home, you can also just enjoy that because you don't feel like your work life is a mess and you're dreading going back to work the next day and you're just so anxious about, you know, when your next shift is, because that's how I felt. The third reason why I left was, in general, on the floors, I feel like it's a very high stress, toxic environment. I'm not saying that my floor specifically was like this. I'm not like calling anyone out that I used to like work with. I don't have any particular people in mind, like I promise. But in general, any hospital floor, unless you like have a really great work culture, it's just a very high stress environment because it's healthcare and it's a high stress environment, it tends to just take the turn into a toxic work culture. I'm not saying that you can't be positive as a nurse. I'm not saying that you can't change the work culture. I'm not saying that there aren't like amazing coworkers who work on the floor with you and they're not positive people. I'm just saying that the tendency is that it turns toxic because everyone's always stressed out all the time. You become almost, it's hard not to develop tough skin when you're a floor nurse, and sometimes developing tough skin can turn into becoming almost hardened or desensitized to like real compassionate care. And I'm not saying that there are nurses that are like that aren't compassionate either. Don't misunderstand what I'm trying to say. But I'm just saying that it's easy for you to turn into somebody who somebody who's like emotionally drained or emotionally, they can't give anything really much to their patients because of how healthcare is. Like, you're just burned out emotionally, so you become almost hardened or desensitized to like people's life scenarios and stuff like that. And it's not to say that you don't want to be compassionate, but sometimes you literally have no time to even like sit down and like, you still talk to your patients, but you don't have time to sit down and really give them that attention and that compassionate care that they need. And so I just didn't like that aspect of floor nursing. I didn't like how everything was always rushed. I didn't feel like, you know, I was giving my patients enough attention or care based on the patient ratios on the floor. Sometimes you're supposed to have 6 patients minimum, and sometimes if you're understaffed, you get like 7, 8, God forbid 9, and that is so unsafe. That's not okay. And I know it's common among a lot of hospital floors, but that's really not okay. And I didn't feel safe that practicing either, going along with what I said earlier. And so I decided this is not. Number 4 would be my physical and mental health. I mean, I kind of alluded to this in like number 1, 2, and 3, physical and mental health, but even as a night shift nurse, I wasn't eating a lot, and when I did eat, I was eating like crap because I just wasn't getting hungry for real food at night. So I would like snack all the time. I felt very unhealthy. You know, even on the floor, you do your best to do the proper mechanics when you roll patients and stuff like that, but my back was still always hurting no matter like if I did it right or not. You're constantly running everywhere, like you get a lot of exercise, you know, get your steps in, but I felt the toll being taken on my body. I didn't have any significant health issues, but my mental health obviously was suffering a lot, and I would come home and be so physically drained, dehydrated sometimes, because when I was on day shift, you weren't drinking, you weren't really using the bathroom, you literally had no time. You would like run to the bathroom real quick if you could sneak it in. Some days you couldn't eat lunch because you're trying to do stuff, and your patients need their meds, and if something comes up, if somebody codes, blah, blah, blah. That was more on days. I didn't really experience that on nights as much, because you did have time to use the bathroom on nights, which is great, and you did have time to eat, which is also great, but I still wasn't eating well, and I still felt very physically and mentally exhausted. So the number 4 reason why I left was because my health was like diminishing, my overall health was declining. The number 5th reason why I left was because I truly did not enjoy it. I literally, those 3 months, it would come into my head every day. I cannot believe I wasted so much time like studying for this degree, and I loved nursing school. I loved like nursing. I loved the education I received. I even loved doing like my clinical rotations in the hospital, but I didn't love the idea or foresee myself even like working in the hospital long term. I always knew I didn't want to do that, but I loved like being able to learn a little bit in this clinical, learn a little bit in this clinical, learn in this, you know, outpatient setting, inpatient setting, whatever, and kind of piece it all together. And so I was really enthusiastic about my career when I graduated, but literally 2 days in, I was like, I can't believe, and then I said, I can't believe that I wasted all my time in nursing and studying and paying those loans and doing this and getting this and sacrificing these nights where I studied and working my hardest to be a nurse, and now I'm working a job that I don't even like. So when I said that in the first week, I was like, I'll just give myself another month, 2 months, 3 months, it'll get better. But by seriously the 3rd month, I was like, I cannot foresee myself even doing this for 3 more months just to make it to 6 or even a year. And I made a decision to leave, and my manager was very polite and understanding of it. And she was like, this is not for everyone. Floor nursing is not for everyone. This floor is especially hard, and you don't have to feel bad about leaving. And I was like, yeah, thank you so much for saying that, because I really want to work outpatient doctor's office. And that is currently what I'm doing now. And it's very enjoyable for me because it fits my life, it fits my schedule. I still love nursing. I still get to practice some of my nursing skills, my critical thinking skills and stuff like that. Not to the degree in the hospital, obviously, but I still get to work with patients, patient care, work on, you know, a healthcare team. And I'm saying all of this to say that if you are a nurse graduate or you're about to graduate nursing school, follow what you know best for yourself. You can absolutely graduate and get 6 months experience as a floor nurse, the typical thing that a lot of people do, or even a year. But you know yourself best, and no matter what your professors and mentors tell you, go into a specialty right away that you want to go into, that you think that you'd enjoy. Because even this example, I hear a lot of people want to be OB nurses or peds nurses, and they graduate and they do MedSurg for a year, and they're miserable for a year because somebody recommended go into MedSurg so you could know more and then go into OB and peds. No, if you want to do OB and peds, go into that right away, because they're going to train you specifically on that unit, what you need to know for OB and peds. You don't have to have prior MedSurg experience. You don't have to know about all these different things, because in OB and peds, you will get that experience custom to like your floor. You're going to see things on your floor. You're going to learn things there. So just go into what you want right away, because it's not worth being miserable for even 6 months of your life and then having the thought and idea of like dreading nursing, like why did I do this? A lot of nurses probably don't even do what I did. I still gave it a chance. I had a temporary outpatient job before I landed this one, and I kept giving nursing a chance. And I didn't just quit right away and be like, I wasted my life, 4 years of my life, however long. I went to community college first before I went to got my 4-year degree. So I just kept looking until I found something that I would like. I applied to so many places. I actually declined so many jobs because once I interviewed, I realized I don't think I'm gonna like this either. And it wasn't a hospital job, but it was a nursing home job or this or that. And I was like, this is not fitting for me, until I found an outpatient job that I truly wanted. And it's not gonna be perfect, but it fit my life and it fit my passions. It fit what I felt I could offer. So do what you think is best for yourself. You don't have to follow the crowd. You don't have to be an ICU nurse if you don't want to be. You don't have to be a hospital nurse. You can, if you want to be a hospital nurse, that's great. That's awesome. Like, I'm not trashing hospital nurses. We need them. We need so many floor nurses. We need ICU nurses. Thank God for ICU nurses. We need ER nurses. But if that's not your personality type, because it's not like the most ideal, nursing job, if that's not your personality type, then don't feel bad about not wanting to be either one of those nurses. You know yourself best, so my advice is to just go in as much as you can, apply for a specialty or a setting, inpatient, outpatient, that you think would work for you, and don't give up. Nursing is actually a really amazing career, and I'm very excited because I'm still very new and there's so much to learn, and there's so many different opportunities that are available in nursing. So thanks guys for listening to my rant. If you like this video, please give it a big thumbs up, and please comment below. Are you a new nurse? Are you about to graduate? Are you still in nursing school? What was your experience like? Are you a MedSurg nurse? Are you a hospital nurse, bedside, outpatient? I would love to know. I would love to hear your story, so please comment below. And thank you so much again for watching this video.